Hello, this is Dr. Gay from First Look MRI, and this is a 38-year-old female with left hip pain. For several weeks, her doctor ordered an MRI to make sure she did not have a labral tear or some other bony problem, and her femoral head here looks great. This is her acetabulum, the cup it sits in, it looks normal. We did some other views to look at the hip labrum. This is one of the views here. You can see the labrum is a little black wedge that goes around the rim of this cup. Her labrum looked normal. Femoral head looked normal, so far everything looked really good with no obvious labral tear or problem in the bone. But she did have another finding in her pelvis. So if we put on a view like, let's say this one here, we see that there's some asymmetry. Her right ovary is this little area right here. Here's your left hip, right hip, and there's a little structure here, which is the right ovary, and we can tell because there's little follicles, little bright spots. Now on the left side, I put a marker on this thing. It's an ovoid area that's bright relative to this right ovary. It's all by itself, so it looks like this is the left ovary that's asymmetrically prominent. And sometimes you can have a complex ovarian cyst that might look like this. And we put up an axial view like this to try to look at those ovaries. On the right-hand side, we see the right ovary is right here. You can see those tiny little follicles. It looks normal. Ovaries can be very hard to see with the small intestines next to them, but this is a typical appearance of the right ovary. And you see the left ovary is much larger, much brighter, and we see that there's a little line here separating ovarian tissue here that's too bright from this thing behind. So this looks like this is a ruptured or leaking ovarian cyst. Usually normal cysts are nice and round and clean. This one has lobulated margins, so it really is a collapsed ovarian cyst, ruptured, and now the lining is coming together and fluid is leaked out back here. So this is fluid in the back of the pelvis called the cul-de-sac. A very common thing to cause pelvic pain. Sometimes you can mistake it for left hip pain. So this is a patient who has a ruptured left ovarian cyst with leaking fluid that is probably the cause of that left-sided hip pain. And that's it. Thank you.